taking up in general pathology. So today's video I'll be mainly discussing upon the very important short note what is being very frequently asked in the professional exams is about the hyperplasia. And mostly they ask you about the definition of hyperplasia and what can be the causes of hyperplasia. So in this video we will be mainly discussing upon that is what is hyperplasia and what are the causes associated to it. So hyperplasia, the word itself is suggesting that hyper means increase and plasia means the cells. So in hyperplasia there is increase in the number of the cells. So what do we find is that increase in the number of the parenchymal cells leading to enlargement of a tissue or organ is called as hyperplasia. So students and viewers, do remember there is another term what is called as this is hyperplasia, and there is a the term hyperplasia refers to at it is an increase in the number of parenchymal cells which cause an enlargement of the tissue or organ. So this is called as hyperplasia, and one thing very important what we need to remember is that hyperplasia is going to persist as long as the stimulus is present. So there is another term what is called as the hypertrophy. So in hypertrophy what do we find is that the number of cells what are located in a particular organ or a tissue, they are going to remain the same in number but the cells are going to enlarge. So in the condition of hyperplasia there is active mitosis which is occurring, which is going to cause an increase in the number of cells, whereas in the condition of hypertrophy what do we find is that the cells what are present in a particular localized organ or a tissue, they are going to remain, the number of the cells are going to remain the same in hypertrophy, but there is only enlargement in the size of the cells. So that condition is called as hypertrophy, whereas in hyperplasia there is an increase in the number of cells, means there is active mitotic divisions through which the cells are going to multiply and increase in number. So hyperplasia is going to persist as long as the stimulus is present. Now when this hyperplasia is occurring, so what do we find is that there is an increased recruitment of the cells from the resting phase of the cell cycle. So you must have read about that during the cell cycle there is the interphase, the I interphase is there, then the beta phase, the prophase, the telophase, these all phases are there in the cell cycle. So interphase, it is the resting phase during which the cell is in the resting condition. So what do we find is during the condition of hyperplasia there is recruitment of the cells from the resting phase of the cell cycle and they are going to undergo mitosis. So mitosis is that cell division in which the cells are going to multiply rapidly and when the cells are getting stimulated. So when we look at that what are the causes of hyperplasia, the causes can be broadly subdivided into two conditions. First, depending upon the physiological hyperplasia, and next it is the pathologic hyperplasia. So what do we find is in the condition of physiologic hyperplasia there can be conditions where in the normal physiology of the body during a physiological process the cells are going to show hyperplasia. So this physiological hyperplasia is of two types. One, it is the hormonal hyperplasia and the next is the compensatory hyperplasia. So in the physiological hyperplasia, which can be brought again subdivided into two, that is if it is occurring under the influence of hormones, so this will be called as hormonal hyperplasia. And next we have the physiological condition, it can be either a compensatory hyperplasia. So this hormonal hyperplasia can be subdivided. This hormonal hyperplasia, when we look at, so under the influence of certain hormones, the cells are going to increase in number, the cells are going to multiply. So the examples for this hormonal hyperplasia, what do we see is that the hyperplasia of the pregnant uterus. So in the condition of pregnancy, the hyperplasia of the cells is going to occur and the uterus is going to enlarge. So the uterus, the hyperplasia of the pregnant uterus, it is an example of hormonal hyperplasia. Just because under the influence of the progesterone hormone, the estrogen, these hormones are going to cause the increase in the mitotic cell divisions of the uterus, in the uterus, the cells of the uterus, and there is hyperplasia of the pregnant uterus. Next we have under hormonal hyperplasia, what do we find is that the hyperplasia of the female breast during puberty, pregnancy and lactation. So what do we see is that during the condition of puberty, particularly mostly it is during in females, what do we find is that in what do we see is that there is the breast tissues are going to enlarge during the condition of puberty, that when the onset of menses is going to take place, so there is an abrupt rise in the hormones. So during the condition of puberty, whether it be pregnancy or when it in the condition of lactation, so when there is milk production by the female, in such condition the hyperplasia of the female breast tissue is occurring, which is another example, which is an example of hormonal hyperplasia. Next, what do we find is that the next example of hormonal hyperplasia is that is the proliferative activity of the normal endometrium of the normal menstrual cycle. So in the menstrual cycle, what do we see is that there is shedding off of the endometrial cells. The endometrial cells are going to shed, and ultimately they are going to pass through the menstrual blood. Along with the menstrual blood, the cells of the endometrium, they are shed off during a normal menstrual cycle. So once the physiological blood loss is there, the menstrual blood loss is there, so the endometrium of the uterus is going to repair itself, and the proliferative activity of the normal endometrium is going to take place after the normal menstrual cycle. Next we have the compensatory hyperplasia. In the condition of compensatory hyperplasia, what do we find is that due to certain kind of a compensation, the cells are going to divide mitotically and they are going to increase in number. For example, the regeneration of the liver following partial hepatectomy. So when there is a partial, in the condition of when the liver is damaged and a partial segment of a liver is cut and taken off the body, so in such a condition the liver is going to regenerate by itself. So the cells of the liver after hepatectomy, once the liver is being, due to certain medical conditions, if the liver is damaged and a certain portion of the liver is to be cut off, so in such a condition that is mostly seen that the liver cells they have the potential ability to regenerate, so they are going to regenerate. So in the regeneration of the liver following partial hepatectomy, and next is the regeneration of the epidermis after skin abrasion. So whenever there is any kind of a skin abrasion is there, the skin gets bruised, the skin gets abraded, so ultimately it has to be repaired, it has to be the healing has to take place. So in the condition of compensatory hyperplasia, just to compensate for that loss, whether it be in the case of hepatectomy or in the case of skin abrasion, the regeneration of the epidermis is going to take place. Next we have the pathological hyperplasia. So in the condition of pathological hyperplasia, what do we find is that there is either in the condition of pathologic hyperplasia, what do we find is either there is an excessive increase in the stimulation of the hormones is there, or these are excessive growth factors are there, what are going to cause the pathological hyperplasia. The examples of this can be looked upon as, that is the endometrial hyperplasia after estrogen excess. So when the estrogen is being taken in excess amount, either in the form of medications or and from any other source, so if estrogen excess is being administered to a woman, so endometrial hyperplasia is seen. Formation of skin warts. So there is skin warts, you must have seen mostly in the patients of who are affected with human papilloma virus. So formation of skin warts from hyperplasia of the epidermis. So the epidermis, the cells of the epidermis, they are going to undergo hyperplasia and they are going to cause skin warts can be seen. So skin warts due to human papilloma virus infection. And next is the pathological hyperplasia. The next example is that the formation of granulation tissue during healing of wounds. So during any kind of a healing of wound, the pathological hyperplasia is seen, that is the granulation tissue what gets formed. So students and viewers, this was a very short discussion where I have discussed in simple terms as to what is hyperplasia, how the cells are, what are the types of hyperplasia and what are the causes of hyperplasia. If you still have any queries queries or comments, you are most welcome to comment me in the comment section. Students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.